burns. Okay. Now, what is see a burns case comes to you in plastic surgeon. But when will you shift a burns patient to a burns unit, dedicated burns unit? Okay, that is the question. So there are certain indications. Any children less than 12 years, whatever small is the burn wound, we have to shift him to the burns wound. Then any inhalational burn wound, inhalational, suppose the patient had inhaled vapor of something, inhalational burn wound, we have to shift, burn wound, we have to shift. Then any wound where there is more than 10% of total body surface area is injured, more than 10% of the total body surface area. We'll see what is 10% and all. This patient you have to shift to a burns wound. Sorry?
Is it Parkland's formula?
Yeah, Parkland's formula will come next. Okay, so children less than 12 years, inhalational burn wound, more than 10% of the total burn surface area. In these three patients, you have to shift him to the burns unit and treat. Okay, these three categories of patients, you have to shift him to a burns unit. That is a question for us. And how to, the most important thing is fluid resuscitation. In a burns case, you have to give them adequate fluid. The fluid which we give is Ringer's lactate. And there is a formula called Parkland's formula. Parkland's formula is amount of fluid infusion should be is equal to 4 into total burn surface area into body weight of the patient. This is how we calculate. Suppose a patient with burns weight of 20% burns are there. 4 into 20, his body weight is 60. So 4 into 20 into 60. So this is the amount of fluid you have to give to the patient over a period of 24 hours. Over a period of 24 hours. This calculation is for 24 hours. And how to give the fluid? Half in the first 8 hours, half in the next 16 hours. Clear?
What is
yes,
TBSA?
no? Sorry?
TBSA?
TBSA is total burnt surface area.
Okay.
Okay. So just not only calculating it, but how to give it. In the first this formula is for 24 hours. Okay. In the first 8 hours, you have to give half of it. In the next 16 hours, you have to give the next half of it. Okay.
Okay, sir.
Yeah. So this is the rule of 9. The rule of 9 by Wallace. Today, remember, one is Glasgow Coma Scale. Morning we have studied about Glasgow Coma Scale. Like just 2 hours before we have studied about Glasgow Coma Scale. And this is rule of 9 Wallace. You have to see this multiple times so that you will recollect it. Okay. So here also the question will be: a patient had a burn wound on the upper thorax, on the upper limb, on the right lower limb. So calculate the burn surface area. Like that the question will be there. So you have to just add it up. So there are 11 into 9. It is 99 plus 1. 1 is in the perineum. See, perineum is 1. Perineum is considered as 1% of body surface area. The rest of them are, see here, face 1, 9, 1, 2, upper abdomen, lower abdomen. Sorry, thorax and abdomen 9, 9, and back of thorax, back of abdomen 9, 9, upper limb 9, and each upper limb each 9, 9, lower limb 9 in the front, 9 in the back, lower limb 9 in the front, 9 in the back. So total how many? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and perineum 1. So this is how you calculate a burn wound. Is it clear?
Yes, sir.
Anyone? You are not understood? SC, a small wound in this area is also considered to be 9% only. A small wound and a big wound, there is no difference. That is the drawback of this rule of 9. Okay. So if a patient had a big wound and a patient had a small wound, we will give 9% only. Okay.
Okay, sir.
Okay, sir.
So 11 into 9 plus 1. Where is that 1?
Perineum.
Where is that 1?
Perineum, sir.
That is perineum. Yes. Okay. So next is degree of burns. Degree of burns is there are
Sir,
type
in
of
every
burns.
to
Sorry?
add 11
Sorry?
means you calculate about the perineum burn surface area, right?
Perineum burns?
Plus
Surface area
1%.
Yeah,
percentage.
surface area of perineum burns is 1%.
Yeah. So we have to calculate, if we have to calculate thorax means we have to put 11 and 9 or like that.
No,
if thorax
each
is there, you have
place
to
we
put
have to put
9.
9 also.
If thorax is there, put 9. If face is there, put 9. Okay?
Okay, sir. Okay.
So there are total, the whole body is divided into 11 9 parts and one part. That is the perineum. Okay?
Okay, sir. Thank you.
So see here the degree of burns. There is superficial partial thickness, deep partial thickness, full thickness, and fourth degree. Here superficial is first degree, 2A and 2B. That is superficial partial thickness is 2A, deep partial is 2B, full thickness is 3, fourth degree is 4. So it is simply, you can remember, there is skin, underneath the skin there is subcutaneous tissue, there is epidermis,
Epidermis and dermis.
dermis which is having two, papillary dermis, reticular dermis, then comes the subcutaneous tissue, then comes the muscle. Okay, these are the layers: epidermis, papillary dermis, reticular dermis, subcutaneous tissue, and muscle. Okay. So if it is only epidermis, it is superficial 1. Dermis partial thickness is only papillary dermis. Reticular dermis is deep partial. If subcutaneous tissue is also involved, it is full thickness. If muscle is involved, it is going below. If muscle is involved, then it is fourth degree. Okay. Why is it important? Why is it important to know various degrees of this one? Degree of burns?
To treat, right, sir?
Yeah, two points. Yeah, to treat basically 2 points. One is to know the expected time of recovery. Okay, epidermis wound, which will be healing time will be just 3 to 6 days. Epidermis. Okay, and little deeper it will be little more. And the wound which is in fourth degree burn, it will not heal. It will not heal at all unless you will surgically correct, because muscle is involved. You have to take a flap or you have to put a graft over it. Okay, so for that this burns degree of classification is important. Is it okay?
Okay, sir.
Yeah.
So can you say it again, please? Epidermis first degree, dermis 2A. Then,
Dermis is having two dermis, right? Papillary dermis and reticular dermis.
yeah.
Papillary dermis
Yeah.
is superficial partial thickness. Reticular is deep partial thickness. If
And muscle
subcutaneous
is
is involved,
four.
it is full thickness, fourth degree.
Okay.
Okay.
Okay, sir.
And
Thank you.
this table also you can just memorize it afterwards. See, healing time is given here: 3 to 6 days, 7 to 21 days, more than 21 days, and it is rare. So it is surgically corrected. Both are surgically corrected. Okay. This is taken from a plastic surgery book, this table. Okay. So it is exactly what is being asked. It is there in this textbook, in this para. Okay. So see here, the sensations are there. This is painful. The superficial ulcers are painful, and then they are painful to temperature and air. Afterwards, once you go into deeper burns, there will be only pressure pain only. There will be no physical, like no temperature or no
Because the
pinprick sensation, only
nerve
pressure
endings
only
will
here.
be damaged.
The nerve endings are gone there, yes. And once you go even deeper, there will be only deep pressure only. Okay, there will be only deep pressure. There will not be any pain, or the patient cannot experience any temperature differences. Only once you press it deeply, the patient can experience a slight pressure. Okay. So these three are important. One is the depth, one is which layer of dermis is involved, what is the sensation, and what is the healing time. Okay.
Okay.
So what is the most common cause of death in a case of burns patient? Cause of death.
Dehydration.
So in early burns period, what is that? In late burns period. In early, it is hypovolemia.
Sure.
Hypovolemia. That is because of fluid loss, the patient will die. That's why we have devised a formula to give fluid, Parkland's formula, and we are giving aggressively fluid management. We are doing. Okay, that is in early wound, early burn period. And if it is late, then what will happen? You have resuscitated. The patient is in burns ward for 20 days, 30 days. You are doing dressings daily. Then what will happen? The patient will succumb to
septic shock.
Yeah, infection, that is sepsis, septic shock. Okay, so if they ask you early, it is hypovolemia, late, it is sepsis. And the most common organism is Pseudomonas. Burn wound, Pseudomonas will grow. That's why we use silver ointments. Okay, silver ointments which will tackle the Pseudomonas infection. Okay, this is about burns. And now